She's Dr. D'Souza, welcome. Welcome, Dr. D'Souza. Please, you are muted. Dr. D'Souza, please, can you hear me?
Mr. Cpd, I think we can't hear you clearly. It's just keeps going and coming. Oh, okay. It's a bit erratic. So
it's erratic. Okay, okay. Please, is it better now?
I think so. Let's see if it goes on for a few minutes without dragging, or else sure. Maybe put off your video and let's see.
Okay, I can hear you clearly.
Oh, okay. So is it from my end? Maybe somebody else should verify online.
No, I think Prince is good.
Yes, I think it's from you, Dr. Souza, because I can hear him clearly.
Okay, so maybe let me check my end then.
All right, all right. Okay, so a short introduction. Dr. Mercy D'Souza is an industrial and organizational psychologist. And she is currently a full-time lecturer at the University of Professional Studies in Accra, that's UPSA. She teaches organizational behavior and management, business ethics, applied psychology, and international human resource management at the graduate and undergraduate levels. She is a part-time consultant with the EduTech Business Consult, specializing in employee wellness, performance, and productivity, and organizational change management as well. She is a corporate trainer at the Institute of Works, Employment, and Society. That is IWES UPSA. Providing skills in cross-cultural management, ergonomics awareness, emotional intelligence, and stress management, gap analysis, and performance management as well. She is a co-founder, or she co-founded Third Sector Foundation, TSF Ghana, a non-governmental organization in Ghana that contributes its quota to the Sustainable Development Goals, the SDGs. She is a mother, and as she will always say, she has been juggling with work, family, religious duties, and all. And if we needed someone to speak to us about burnout, then I think a psychologist, an industrial one as that, a mother, someone whose schedule is very, very tight, I think will be able to empathize with us and know what many of us may also be going through, so that she can really relate to us what burnout is, how we can deal with it, and how we can be sane in our minds and psychological health to be able to perform our duties as dietitians and nutritionists. So without any further ceremonies, I would like to introduce to you, House, Dr. Mercy D'Souza, to take us for this 2-hour stretch. Thank you so much, ma'am. Welcome.
Thank you, Mr. Cpd. Thank you very much for the introduction. What for me is very interesting and I identify with is what you said, that I really identify with you because I think I categorize myself as part of you, a profession that sometimes people find it difficult to say they are paying this much money for a nutritionist or a psychologist because it's not a headache, it is not a stomach ache, etc. So it's a profession that sometimes, apart from the normal stresses of life, personal, organizational, we also have the cultural aspect of it. where the medical culture, the acceptance for these services, it's a bit problematic. So I do identify with you. If you can please give the chance to share screen so that we can start a screen share, I will be grateful. So I'm here with Mr. Erasmus Kelly Swansea, and also a surprise co-partner online. She is Dr. Beowulf Caesar, a clinical psychologist who will help us to also be answering some of your questions. I just asked her to join us. She's a partner in training. We do most of our trainings together, and she'll be here with me to answer your questions if there are any concerning, especially she's clinical and I'm industrial. So Mr. Swansea, I would want him to just give you a brief, let me say, about himself, who he came from Maastricht, just to do certain things in Accra, and I'm also doing certain trainings or doing some trainings with him. So let him tell you a bit about himself. He's sharing the screen now, and afterwards he will take over and tell you a bit about himself. Basically, he will take from, we're going to talk about stress, very important. He will take the first part of it, because stress leads to burnout. If you're able to cope properly, then it's not everybody who gets stressed or get to the stage where there is chronic stress that you would enter into the stage of burnout, depending on how you cope. So you take the first part, and then I will come in with the burnout, and then we talk about strategies we can adopt to make sure that we don't get to the stage where now it becomes real mental disorders, anxiety, suicidal ideations. Of course, they link with other things before it comes, but we don't want to get there. So, Mr. Erasmus Kelly, are you ready, please?
Yeah, thank you, Dr. D'Souza.
Okay.
And also good afternoon to everyone online. My name is Erasmus, as Dr. D'Souza already introduced me. I studied in the University of Cape Coast. I did BSc Psychology, and then furthered my master's in Organization and Work Psychology at the University of Bologna, Italy, and also in Barcelona. After that, I decided to pursue, or I'm currently pursuing my PhD at the University of Barcelona in Organizational Psychology and Human Resource Management, while I am also working as a full-time lecturer for the University of Maastricht, which is in Netherlands. Regarding my area of teaching, I specialize in organizational leadership and other organizational behavioral courses like managers at work and business administration, and also communication and effective leadership skills. So these are some of the areas that I specialize in. So today, what we have prepared for you is going to focus on stress and burnout, as Dr. D'Souza already said. And then the second part we are going to look at is the process of burnout and the effect of burnout. And then lastly, and which is the most important part of this workshop, is how we can manage burnout within ourselves. So this is very, 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 very important. But I must also say that we will be doing a lot of activities that will require your cooperation. We have to discuss a lot of things. So once I ask any question, you should try as much as possible to participate to make this session more participative and inclusive. So before we start with our stress burnout, the first activity that we would like to go is that I would like everyone to try. Yes, I would like everyone to try first, starting with the Kahoot. Okay, let's see. Okay. Yes, so we're going to start first with the Mentimeter, and I'm going to put the link of this in the chat for everyone to try to participate. So I'm going to paste the link here. Where everybody could kindly click on it. And also, this will be the code that you are going to use.
That's it. Zoom.
Yes, so we have the code here. Once you click on mentimeter.com, you just have to put in this code, which is 78069086. And you just answer the question. Once you answer the question, everybody will see the answer, but we won't know that it's from you. So feel free to share your ideas, okay? Is there anyone already in? Is there anyone at least?
Kelly, you haven't put in the code. I can't see the code.
I have the code here on the screen.
All right, please, let's put it 7070. I'm sorry, 7806. Okay, 7806 9086. So we're just trying to play a little bit before we start. Yes. So if we go there and you enter the code, you just answer the question. Just a relaxer before we start digging into.
Is there anyone joining now? Because it seems no one has joined yet. Yes. Yeah, now people are joining. Okay. Exhaustion. Right. Yes, so it seems that most of the words that we are using is tiredness, because tiredness is the word that is in the middle or at the center. So tiredness, we could see a lot of people also saying frustration, others also saying pressure, exhaustion, workload, your body cannot cope, depression, constant distraction. Yeah, so we could see a lot of words being used here. We could see mental exhaustion. We could see emotional strain and excessive pressure. So thank you guys for really giving out several responses. Now, you could see frustration, tiredness, exhaustion, pressure. Okay, let's go to the second one, which is in the same 2 or 3 words. Can you explain what burnout is? Yes, can you explain what burnout is? Just as you did for the first one, you could do the same for the second one. So I'm waiting for responses.
Yeah. Kelly, is it the same code?
Yeah, the same code.
So when you use the same code, it goes back to stress.
Okay, let's see.
We have to refresh, yeah.
All right. Then I think we have to go to the second one. Yeah, can you see this on your screen now?
Yes.
Okay. Yeah, so in this the same vein, let's also put in our responses for what we think burnout is. Okay. Feeling overwhelmed, inability to, we could see excessive workload. Yes. Is there any more? Okay. Overwhelmed, drained, depressed, frustration, low energy. You could see low energy. When one reaches his or a limit, yes, that is also true. Yes, you can see fatigue. Yeah, apathy. You could see chronic fatigue. What again? Being overwhelmed. Being overwhelmed. Yes, overwhelmed is the word that we are using mostly. You could see exhausted. You could see fatigue, excessive stress. Okay. Okay. Yes. All right. So it seems that fatigue is the leading word that we use to explain burnout, whilst we use tiredness to explain stress. However, you could see that the same words that we use to explain stress, you could find similar ones when we look at burnout. For example, we have exhaustion, which is placed there in burnout and in stress. We have fatigue, we have depression, we have being overwhelmed. We could find all this also in stress. So the question now is, what is the difference between burnout and stress? Is there anybody willing to explain to us the difference between burnout and stress? Who would like to turn on his mic and explain to us the difference between burnout and stress?
Hello, Erasmus.
Yeah.
Yes, I think burnout will be, in my words, excessive dose of stress, or
Okay.
being too much stressed to the extent of not being able to continue with whatever you are doing.
Good. Yeah, you're right. Excessive dose of what? Stress. Yes, you are perfectly right. Is there anybody willing to also share any idea? Okay, somebody is saying that stress is a contributing factor to burnout. That is also perfectly true. We cannot deny the fact. However, stress is more a state of worry and mental tension that is caused by a difficult situation. Some situation that may occur at the workplace, some situations that may occur with your duty as a dietitian or a nutritionist or anything that may cause mental tension to the person. So basically, stress is how we respond to this kind of things or this kind of situations that we experience in our daily life. So it's not something that is bad. It's something that could be good, but an extreme form of it is what causes burnout, and you're going to look at it. However, burnout is more of a psychological syndrome that's when an individual experiences, the individual faces emotional exhaustion, depersonalization, and reduced sense of what? Professional efficacy. So whilst we agree that burnout is an extreme form of stress, this extreme form of stress leads us to become emotionally exhausted. It makes us to become depersonalized with ourselves and makes us to think that we are not even effective anymore. We are going to examine more of these three dimensions of burnout in the subsequent slides. Now, as I said earlier, stress is not a bad thing. Yes, because if you have a very low level of stress, you are likely not to perform very well. For example, a surgeon going to do an operation that involves the cost of human life. If the cost of human life does not stress him up a bit, he may make mistakes or he may decide to forgo certain things that may cost the person's life. However, if there's too much stress, tension on him regarding what he's going to do, there's too much anxiety on him regarding what he's going to do, he is also likely to make mistakes that could result in someone losing his or her life. So when you look at this stress curve, you realize that at the lower level, too little stress, performance, the level of performance is still lower. But when we have optimum stress, when the stress reaches an optimal level, our performance increases, which shows to us that stress is a good thing. Having some level of stress is a good thing. But extreme form of it is what starts leading to negative experiences. And then when we get to the peak, now fatigue sets in, exhaustion sets in, anxiety, panic sets in, and then finally we break down. And when these things start setting in, our performance starts reducing. So it's very important because you can't understand burnout fully without understanding stress, because they are more like brothers. One comes first before the second. So we could say that, for example, stress is the firstborn, and then burnout becomes the second born. So having explained what stress is now, we could now look at the differences between stress and burnout. Now, when we look at this, you see, stress sometimes makes us to be over-engaged in certain activities. Sometimes you could have too much stress, but also not burnout. Sometimes at work, you could have a lot of tasks to do, and you'll be like, whoa, I have a lot of things to do, and I need to clear it up quickly. And it makes you become more of a serious person, and you tackle all these activities one by one. And this stress can also cause you to be a little bit anxious, and it makes you to get the tasks done, as I said earlier. However, when you look at burnout, burnout is when you are totally drained. When you are totally drained. So too much of stress at a particular point may not lead to burnout. But a subsequent form of stress, that is when you keep facing too much of it. For example, today you went to work and you had a lot of things to do. In fact, you could say that you were too stressed, but this occurred only once. So it doesn't lead to burnout. Although the stress was too much, it does not lead to burnout. When the stress becomes consistent over time, that is when it cannot lead to burnout. So we should understand how it is. For example, say, if I could just get everything under control, I'll feel that this person is not really burned out, it's really under stress. Maybe there are a lot of things and he wants to get under control. Now with burnout, you are exhausted and you don't care anymore. So understanding the differences between stress and burnout is very crucial for us to know what burnout is. Now, looking at the burnout dimensions, the first one that's usually setting is exhaustion. This is when you feel like you are tired, you can't do anything. When you are weak, fatigue sets in. You don't feel like doing anything because you are extremely tired. That's the first dimension of burnout. Now, when it happens this way, you develop this depersonalization, feeling of depersonalization and what cynicism, which is more of you detach yourself from work. Now, work doesn't even concern you anymore. Even if a patient comes to you for treatment, you do not care. If there are people in line waiting for your services, you do not care. Now you have reached a stage where nothing bothers you anymore regarding your work. And this is some of the things that makes burnout very important for us to discuss. You are a worker, especially those health professionals. Your services are very crucial to us. But when you reach a stage where you don't care, it becomes a serious situation. There will be a lot of patients in queue, and you, the specialist, you will just be there because now you don't care anymore. You can just decide to attend to only 3 or 4 and say that you are done for the day. The rest of them should go because you don't care about your work anymore. And then the third dimension of burnout sets in here. Now you feel personally, your personal accomplishment now reduces your performance. You evaluate yourself as someone who's doing nothing. So here it says it's a negative professional self-evaluation and doubt about your ability to do your work effectively. Because first of all, you are tired. You feel that you have no energy left in you. Now you are unconcerned. You don't care about your work anymore. And now you feel that you won't be able to perform your job effectively. And when these 3 things come together, that is when you can see that this person is really, really, really what? Burned out. So this cycle shows how somebody is what? Shows how the dimensions of burnout operate. You could see exhaustion at the right side, cynicism at the top, and low professional efficacy at the left side. Now, burnout is in the middle of what? This treatment. So when I said we should explain burnout using 1 or 2 words, some majority of you said being overwhelmed, being exhausted, fatigued, tired, and stuff. These are just one aspect of burnout. For example, being exhausted doesn't mean you are burnout. To experience burnout, these 3 factors must be in play. That's when you could see that you are really, really burnout. When you are emotionally exhausted, when you do not care, you no longer care about your work, and when there's low professional efficacy, when you start feeling that you can't do your job effectively, that is when you could say that, oh, burnout has occurred. So the next time someone asks you to explain what burnout is, you could use 3 words to explain what burnout is: being exhausted, cynicism, and what? Efficacy, or maybe low efficacy among yourself. So this is what I want you to understand when we talk about burnout. Now, it's very important for us to know the process that burnout occurs. We brought up 4 stages through which burnout can occur. And the first one is work-related stress. Yes, we, in our daily lives as nutritionists, then dietitians or healthcare professionals, several things may cause us to be to be stressed, especially maybe the number of patients we take care of during the day, or maybe other factors in the organization. We are going to look, you are going to focus more on this in the next slide. So work-related stress is the first thing that that could be placed on the road to burnout. Now, the second thing is strain. When you talk about strain is also more or less like stress. So these work-related stresses or stress will lead to you experiencing strain. And this strain, when it becomes consistent and stay over time, may make you be exhausted. Now you realize that you have low energy and everything. And this exhaustion will finally lead you to being burned out. So this is how this process occurs. But in the next slide, we will try to look at what are some of these work-related factors that may cause stress and definitely lead to what? Burnout. So in the first way, we look at the intrinsic job factors. We as dietitians, we as healthcare professionals, what are some of the things that may first lead to stress? The first one is poor physical working conditions, especially we being in Ghana, where we have our infrastructures not fully developed or not fully improved at our workplaces. You may find yourself working in an environment where maybe it may not be conducive to your liking. For example, maybe there's no AC, there's no fan, maybe the lighting is poor, or maybe there's no ventilation just flowing, and these things could disturb you, and it could be what a stressor for you. We have others like workload. As we all know, healthcare professionals in Ghana, for example, in Ghana, are being bombarded with a lot of workload because the ratio of one healthcare professional to patients is even more than those in different developed or Western countries. So it has been reported several that the workload of healthcare professionals is extremely high, which could be as a result of that stress that you experience as a healthcare professional. The second one is the time pressure. For example, you know that you have to work from 8 to 12. And within 8 to 12, you are supposed to take care of maybe 15 patients. Now you come outside and you see that you have almost about 25 patients over there. And this would cause more of pressure because you know that if you don't take care or if you don't deal with the patients as soon as possible, you may have to overstay. And you personally don't want to overstay. Maybe you have some important things to do, and then you have to start dealing with them quickly. The pressure that is on you. So time pressure is also another aspect. And long working hours is also another aspect. Sometimes for the love of the job, even if your time exceeds and you check and you realize that, oh, there are still about 10 patients there that you have not attended to, you try to attend to them. And this takes in more of your working hours. So this is a crucial stressor that we need to pay attention to. The second one is the role in organization. For example, role conflict. Role conflict is when you have several roles that conflict with one another. So maybe, or when you receive different roles that conflict with one another, maybe one of the supervisors will come and tell you that, okay, Jacob, can you do this? Then another supervisor will come and tell you, Jacob, can you also do this? And these two things may be what conflicting because you have to do this at the same time. Then we have role ambiguity, which is also a key stressor. For example, new health professionals, they will require their supervisors or their managers to lay down specific duties for them. But if you just put them in the office and say, in the healthcare office or the workplace and say, yes, you attend to anybody that you like to attend to, and then he doesn't even know what he's supposed to do. Because if he says you attend to somebody, there are several things that is expected of him. How is he going to do it? Can he do it based on the way he wants or based on what the hospital prefers? So this role ambiguity also serves as a serious source of stressor. And responsibility of people. Sometimes you are working in a place where you don't know who is doing this and who is doing that. And then this also causes stress because if you could end up being the only person working whilst other people are what? Sitting, because nobody has a clear responsibility. And this also affects the stress level that you experience. Now, career development, it's also a crucial thing. For example, of being over-promoted. Sometimes in our area of work, promotion is given to someone who does not deserve it, or maybe someone that has not reached the level to get in that position. And then you realize that when you are being promoted, over-promoted, even you yourself, you start doubting yourself. Whoa, why have I been over-promoted? And your colleagues are also going to start asking questions because maybe they believe someone may be more qualified than you. And then you have maybe one way or the other maneuvered your way out to get that position. And then it starts with conflict and stuff, which what leads to stress. Now, being under promoted, you expect that you are the one that qualifies for this position. This is what I expect. This is the position. Everybody knows that I'm the one that's supposed to be given this position. And then you are not given that position. And then you feel like you are being under promoted. Or maybe when there are some vacant positions and you expect that you should be given position A, and unfortunately you are given position C, you feel like now you're being under promoted. And this kind of feelings also leads to stress. Thwarted ambitions, when sometimes, for example, you are working in the healthcare and you are thinking of, maybe I would like to work at the organization, or maybe I would like to work at the private sector because I've read this and that and that. And you are confused, not knowing what to do, especially maybe somebody is also offering some job over there, but maybe the salary may differ and stuff. So these thwarted ambitions will also cause stress in our career development. Now, relationship with work, as I said, it starts from relationship with your boss and relationship with your co-workers. If you have good relationship with them, then that's all. But if you have poor relationship with your boss, it's extremely stressful. If you have poor relationship with your co-workers, you keep fighting every day. This is something that we also need to take into account. And the last one is organizational structure. When there's certain decisions going on and you are not called on to engage in these decision-making steps, or when you are supposed to do certain things, but then there's been some restrictions in the organization that does not make you to exhibit some forms of behavior. Also, when you have toxic environments are more like an organization that you have that has toxic culture, where people don't care about people, where supervisors are abusing their subordinates, where you are being like placed in uncomfortable situations each and every day at workplace. Another thing that could also affect our stress in the organization is office politics. These things are also very crucial. That could also cause stress in the organization. However, as you could see this relationship going straight to stress, it's not simple like that. First, certain things may facilitate this. Maybe the individual already experiencing these stresses is having some family challenges. He's already having some life challenges. Maybe he's already stressed, like some challenges are already stressing him. And then he comes to the organization and these factors are also there. And this will rather increase his level of stress that he experienced. And that is something that we need to also take into account. The most important thing for today, and the most important thing that I would like us to know, is that the rate at which stress affects us depends on the individual. That is the most important thing that we are supposed to discuss today. First of all, the personality of an individual may determine how these stresses may cause stress. So we should keep it in mind that the first factor, for example, when you take a personality type like someone who is neurotic, a person who is neurotic always sees negative side of things. A person who is neurotic always experiences anxiety. He's always anxious of himself. So once there's any little thing occurring in the organization, he just sees it to be like a very extreme thing. And then he or she gets more anxious and more stressed. However, a person with a form of like conscientiousness, somebody who plans, who organizes himself, who perseveres, will see this kind of things and say, oh, these are challenges I must overcome. And then he does not feel stressed. Okay, so the rate at which these job stresses affect our stress levels or our stress experiences, which in turn affect our burnout, depends on first of all, individual's personality. Now, the second is also recovery strategies. For example, if I ask a question here, how many of you do go to the gym, maybe after work? How many of you are going to raise up your hands? If I ask, how many of you try to go for jogging? How many of you are going to raise up your hands? So these are some of the things that we need to take into account. When you talk about coping behaviors, yes, we also have coping behaviors that as individuals we need to adopt. For example, when somebody experiences stress, some stresses in the organization, he or she may adopt some coping strategy that could be problem focused or emotional focused or so. With this aspect, Dr. D'Souza is going to highlight more on this kind of thing. But what I just want you to know is that these factors you have identified on itself does not lead to stress, but what makes it leading to stress is based on the individual. And we identify 3 factors: personality, recovery strategies, and coping behaviors of the person. However, burnout has a lot of factors. These effects are low work engagement, performance, commitment among work-life conflict and stuff. But then when we look at it here, you could see that the effects of burnout can be divided into 2, where we have the professional aspect, where it could affect your job, like decreased quality of care, increase in medical errors as a health professional. Yes, if you are extremely burned out, you may fail to even administer the right dosage to the patient, which may lead to medical errors. This is something you need to also keep in mind. Decreased patient satisfaction. Yes, if I'm a patient, I come to you and even looking at you, I can see that you're extremely tired, and you just say, "Oh, what's wrong with you?" Okay, just take this, go to the pharmacy and take, without having time to speak with the patient. Maybe the patient came with this problem, but there may be some underlying hidden problems that if you took your time to speak with the patient, you may have identified it, but you are already burnt out. You are tired, so you just want it to be quick. And it is decreased patient satisfaction. Decreased productivity and professional effort. Yes, your performance decreases as we've already discussed. And also more of turnover. It has also been reported that healthcare workers who are extremely burnt out decided to quit their jobs and go in for a different job. So this is something that we should know. Besides professional, it also affects us. It also affects our personal style, which is broken relationships. Some of us resort to drinking of alcohol, which is maladjusted coping strategies. Dr. D'Souza will be talking about it. Depression and even suicide. So based on this effect, it shows how important it is for us to try to manage burnout effectively. So with this, I would like to also send, before Dr. D'Souza will come in, there's a second set of survey that assess your recovery aspects that you would like to send in this group for everyone to fill. For those of you who have not filled the first form, please do want to kindly fill the first form. And at the end, try to fill the second form, because at the end of this meeting, we are going to run a short analysis to explain to you how the results or how the survey you filled relate to your personal experience to burnout. We do not want to bring in reports from findings from other studies. We want to use your own experiences to explain to you how you can deal with burnout. So please kindly complete the second form of survey that Dr. D'Souza is going to send to the chat. And maybe after that, Dr. D'Souza will now move on and talk about dealing with burnout. So Dr. D'Souza.
Yes. Thank
Yes,
you very much.
Could you kindly send the link to the chat?
Yes, if it's possible, if you stop share, let me start share. Whilst I'm starting the share, you send it. So you can stop her. So let me start share and then you send it whilst I'm doing the share.
Okay.
Okay, if I can have some feedback, if you can see my screen clearly, I'll be very grateful if I can have feedback.
Yes, your screen is very visible. Okay,
All right,
you can see.
thank you. So whilst Mr. Swansea is sending the second, like he mentioned, we just want just not to do this and then you finish and you don't know exactly what is happening in your lives. We can't assume that you are stressed. We can't assume that some are burnt out, but it may be best to really tell you what is actually happening. So if you can, as soon as he posts the second survey, you can go ahead and do it. We'll be grateful.
Yes,
and
I have posted the second survey.
all right. And for your information, it's not taking your email addresses or anything. No. So you can see that the email address icon is crossed. So it's just anonymous. So he has spoken about stress, what happens when you are stressed. And I think we have realized there is good stress. That stress that really makes you want to do something. Imagine you're going to Dubai and you've packed your luggages and you have to get the airports and you have to get the terminals and the gate. You know, you are stressed trying to pull all the suitcases along and the children are screaming. It's good stress because it's like you're excited. Finally, I have money to go to Dubai. So there is good stress and there is bad stress. And how you handle the stress from becoming chronic is very important. So we looked at stress now. I would deal with some of the strategies, what you can do. And I give you this quote by Mary Engelbright. If you don't like something, change it. If you cannot change it, change the way you think about it. So there are many ways of handling your stress and dealing with it so that it doesn't end in burnout. So your efforts to control, to reduce, to learn to tolerate these threats is very, very important. Let's start with a model. It says the AAA model of stress management. You can either avoid, you can alter, adapt, accept. You can avoid it. It is possible to escape some of the minor stresses that tend to trouble you. Okay, so for instance, I use a typical thing like you stay on the Spinters Road and you know there is traffic. You have to get to work at a certain time. It's stressful. For me, I'm using my example to drive in traffic. So I leave at 6 so that I can get there even before the cleaners get there. By so doing, I will avoid the stress of driving through the traffic. If I cannot change it, I cannot alter it completely, I've tried to avoid it. I can also decide to just accept it and make up my mind, oh, that's how it is. And I know people who just accept it, it is there. If they can afford the fuel, they go ahead and they move on in the traffic. Or you can adapt to it. One of the ways I adapt to it is that I try to find maybe audio recordings, either of preaching or of a book, a textbook, and I'm listening. So whilst I'm listening, at least it helps me to adapt to the stress on the way to work. So there are many ways. Either you, if you can mute I don't know whether I'm co-host, but Mr. Prince Bede, if you can mute for me, I'll be grateful. All right. So some people, thank you. Either you change the context or the content, you reframe. For example, imagine there's a car in front of you and you're really, really in a hurry and the car is going very, very slowly. You can change the context or the content by reframing. What if in that car is your old grandmother you love very much? You say, oh, that's grandma driving. I'm proud of grandma. And so instead of doing pom, 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 you reframe and you go a bit slower. So you see, some of the things that really, the stresses, we can do something about them. That is, if we know, if we relearn, if we are able to know that we can reframe, we can do something about them. It is not that easy, but it starts with first the awareness of knowing that you can do something. So the 4 A's, I will not go too much into them because we're going to look at real strategies of managing our stresses. And we have divided these into 4: the cognitive, the sensory, the physical, and the emotional strategies. Mr. Swansea spoke about your coping. It's very important. Some really cope so badly with stress that it becomes a spillover. So right now we talk about, first they say work-life balance. Imagine you can never balance work and life because as soon as one side tilts, the other side also tilts. But we have now what we call work-life flow. You should be able to get into the flow such that you manage all the areas. And these strategies we are going to talk about are some of the ways or the things you can do to make sure that you get this flow in your work and life so that you don't get to the stage where you have to see now a mental health professional. It is not wrong to do it. If you are really in need of that, it's okay. But we can start first by using these coping strategies, managing and knowing who we are. Okay, so Mrs. Swansea spoke about certain personality types. If you know yourself, you know how you handle, you know your strengths, you know your challenges and how you handle stress. Therefore, you take yourself away from situations that will bring you to the stage where you can't cope. The first relief strategy we want to talk about is the cognitive. I always say, if you have a physical ailment, okay, you can just go and see the doctor, he gives you paracetamol. But the most important part of us that we have to take care of is our minds. It is a battlefield. I don't know what medicine you will take for an emotional problem and mental health. Yes, we do have trained experts. We have professionals who can help you to deal with some of these issues, but it's not as easy as taking paracetamol. So please, if we don't really get anything at all, we need to get this. Have you ever wondered why, when you are in a plane, when the air hostess starts telling you about the safety strategies, he or she starts by saying that before you even, if the mask should drop in an emergency, before you help somebody, fix yours first. You are a healthcare professional. Some of you are the main breadwinners of your families. If you can't fix your mask first, meaning if you don't take care of yourself first, everyone depending on you, your family, your friends, they will all collapse with you, just as in the plane. If you don't fix your oxygen mask first, you can't help anybody else. Excuse me to say, you are useless to the people around you. So self-care, being a little selfish in this matter is important. And I know we have superiors online, we have supervisors online. We saw some of the things Mr. Swansea spoke about. Please, there are issues in the workplace, especially subordinates are not so much, they cannot be so much, in quotes, in charge of what happens to them in terms of the stresses. So some of the role ambiguities, the reporting relationships, the stress at work, the working situations, the organizational factors, please help to take care of it so that we all can forestall the mistakes we have seen, the professional mistakes that can happen because somebody is stressed, overstressed, chronic stress that can lead to other things. Cognitive. The first thing I'll talk about is a spiritual self-care. I'm a Christian, so I'll give examples from my Christian life, no offense to other religions, but we always say that it's good to start the day with spiritual self-care. Whatever religion you are, I believe that the world is so erratic now. We say we are in a VUCA world. We are in a volatile, uncertain, complex, ambiguous, and rapidly changing world. And COVID gave us this example. So how do you now move out to meet all these challenges without spiritual self-care? So one of the first things is spiritual self-care. Some would say in other religions, they use guided imagery. But as a Christian, I would say it's quiet time. quiet time to get to the place where you feel safe, puts you in a situation where you have read your Bible, had scriptures that will take you through the day, and you get to the place where, I mean, it's like you feel so enclosed, safe, nothing can harm you. Spiritual self-care, change your perspective in life, the cognitive, it's about your mind. The mind is a battlefield. Have fresh perspectives in life. Yes, there's going to be you are going to be laid off, or there's layoff, or there is a merger and something in the organization that is going on. Can you look at it, reframe, look at it in another way? Well, this is going to happen, but it may be an opportunity for me to do this or that. And one thing that I like a lot, and we have put it there, is that have a mantra, but let me say, have phrases, remarkable phrases that calm you down to help you stay in control. And I have Dr. Usiza online, and one of the things we used to tell ourselves in the 4 years of doing the PhDs, all shall pass. So when you get into a situation where it has to be with a supervisor or something, then you say, oh, all shall pass. Yes, in 4 years, it will be over. You need to have phrases that you talk to yourself. You need to pep yourself up. All things work together for good. I know that these two would work together for my good. And ironically, we have an example with our present party. I'm not NDC, I'm not MPP. My party is Ekwadonko. So I'm not trying to be political here, but I know they also have a phrase. Okay, I've forgotten the phrase, but I know the president had a phrase, and they used to say it anytime they are on a campaign trail. So yes, it's good. And play games, okay? Chess, Sudoku, and other games to keep your mind a break. Even at work, sometimes when you are on snacks or you are on lunch, try and occupy your mind with something else. There are many cognitive relief strategies you can use, but these are the few we want to bring your attention to. Practically, you need to let your mind work, because you see, the mind is also a muscle. You train it, you exercise it, it works for you. Now, we'll talk about the physical relief strategies. And this Madagascar movie comes so much in mind. I got to move it, move it. So move it, okay, move it. I know Mr. Swazi asked a question, and I was laughing because I am also, I fall victim. Exercise is not my thing, you know, and I go into my compound and I walk around, I jump, and I think I've exercised. And somebody remarked, is that all? So let's move it. And we will get to the stage where you realize that exercising really releases certain hormones, releases certain good things. Let me use the things inside of you. So yes, move it, jog, walk, go to the gym, dance classes, even get a punching bag in your house and punch it. Now, sometimes, let me use, as Africans, we are so used to being very strict parents at home that we can't even play with our children. But one of the things you can do if you have kids at home, run around, let them use them as your exercise, exercising partners, or a chance to exercise. Let them, kids are really energetic, let them move you around, etc. And it helps, it helps. I think a month or two ago, the Mental Health Authority dealt with the role of sexual relations. Yes, it's been also found that it's a form of exercise. If it is okay with you and you are healthy and everything is fine, it's one way where you can really move it, move the muscle, and work on your physical relief strategies. The same way your body prepares to fight or flee on the physiological level, when you boost it and everything is working, it helps to release the good hormones. I move on to the sensory. Yes.
Yeah, please. The second survey link has not been sent. So if Erasmus can send it again,
Right.
People are requesting for it in the chat.
Right.
Yeah, I have posted it in the chat. Can you not see
check
it?
whether you sent it to me as a private message or a general message.
No, okay.
Yeah.
All right.
Yeah. Yeah,
Oh, all right.
Okay.
Sorry. So then I'm going to post the link.
sure.
Yes. Can you not see it?
Yes, it's here now.
Okay.
All right. So then the other one is a sensory relief strategies. Sensory relief strategies. You know that sounds, sirens, if you live in an area where every day, maybe you live by the roadside and they are, I know there is one Mark Davis truck that parks in front of my house. Mark Davis, whatever, and every day. If you can't understand, but a constant disturbance can really stress you. It affects the sensories, okay, your sensory system, sensory organs, your ears, your whatever. So sounds, noise is a major contributor of stress. You would not really understand this till maybe you're living in Europe and you live by the train line and every morning you would know. The same way, if it can affect you and stress you, then if you engage in things that will really let your senses relax, aromatherapy, warm baths, sleep, massage, some of these things we are unable to do because, excuse me to say, sometimes even the money to use to buy the kenke and the fish and the banku and the things is not there. But if we think on the other side that if you do it, you prevent yourself from getting to the stage where stress, overstress sets in, chronic stress sets in, and then it comes with other things like burnout, anxiety, and you may have to see the psychologist, then it's best you start on a very good note. Connect with your environment. If you like walking, go and walk. If you like to go by the seaside, find a seaside where you don't step in horrible things, and just listen to the birds. It's surprising, but now we don't even hear the birds chiming in the mornings again because we've cut all the trees. But these are things that really will help you to relax. The sensory. We would share the slides, so I want to leave enough time for questioning. So I will go on to the emotional relief strategies. There is a hormone, oxytocin. It's known as the love hormone or the bonding hormone. And it's been found to release stress a lot, okay? It helps release stress. The stress hormones are also there, okay? The adrenaline, noradrenaline, and everything, the cortisol, etc. But these are the ones you don't want to release in your body. So the bonding hormone, there are things you can do that release the famous oxytocin and get rid of the cortisol in your body. Hugging, making love to someone you care about, releases this. And this is one of the really reasons why the Western world, they get pets. It's been shown that it's not just about just having the pet, but be able to hug the pet and other things help to release this love hormone. They call it a cuddle hormone. It helps in social bonding, and that's the same in parent-child bonding. Also, oxytocin is released. In sexual intimacy, it is released. Overall, it plays a very crucial role in reducing stress. Okay? Fresh perspectives, having an extra pair of hands to say, that's why they say a problem shared is a problem solved. Having an extra pair of hands, humor also helps to release this hormone. It's been found recently that gratitude, those who count their blessings, really also are happier and they are less stressed. Emotional tears. And I put the worship there because sometimes those of us who are Christians, you don't understand the warmth you feel when worship is going on and you see tears just streaming down your face. These are emotional tears. These are good tears that they release oxytocin, okay, which helps because the tears, out of it comes the adrenaline and the cortisol. So the crying is good crying. Music has also been found to be very good, but better still, I say join a choir where you can be singing every time and be happy and singing. So these are some of the emotional relief strategies you can adopt. They look so easy, so simple, but you will agree with me that these are things that we just look on as if they don't matter, or we think we don't have the time to do, but they are important for us. Relaxation, the state of being free from tension, anxiety, etc. We may go through certain techniques a little bit. Sometimes you are in the office, the same way when you are frightened, your muscles tense up, you are ready to fight or flee. The same way, if you teach your muscles to relax, it helps you to relieve stress. You have the power to teach your muscles to relax. And we'll look at one very important one, and some of you may know it, we call it a progressive muscle relaxation technique. It is an exercise that it helps you to make the muscles less tensed. It helps you to also control your breathing. It helps you to find a comfortable position for most of the muscles that are tense. You release them, you tense them, you release them. So you teach your muscles to relax. And you can do this for every part of your body. You can lie flat, start from the head, relax every muscle, relax your face, crunch it, relax it, crunch another part, relax it, so you get to your toes. For those who want to try, I would say, let us try and put all, if the videos, you can put your video on without it disturbing you, you can, so that you don't laugh at me when I crunch my face, then I can also have somebody to laugh at. So those who want to put your videos, let's put it on and let's try and see whether we can do the progressive muscle relaxation. So imagine you are in the office. In fact, even if you do this and you are with colleagues in the office, everybody can start laughing. It can help. It can help. Sometimes we are too strict. And so this exercise, this is how it goes. So you can sit comfortably, like how I'm sitting now. The first one is with your face. So first you crunch your face. Do it as if you are making your eyes like let me see, a Chinese, Japanese person. So you crunch your face in a certain way. And we all try, squeeze it very hard. You can count 30 seconds, but squeeze first. And then release. You can just feel, but it starts with the breathing. So the breathing exercise starts first, but you can crunch every part of your body. You can also stretch your hands like this, tense your arms so tight. Then count 30. And release. So these are exercises you can do, especially for those who travel long distances. Even whilst you're seated in the plane, you can be doing this so that you don't have sometimes thrombosis. Okay, you can have certain veins become so tense that if you can get into trouble while seated down. So while seated in the plane. So basically, this is it. I would send the explanation or the instructions through Mr. Prince Baidu, and so that you can do your exercises if you want to engage in the progressive muscle relaxation. I would not want to take too much time on that. So thanks for those who did the only two that I was able to do. In the office, these are other ones you can do whilst in the office. Okay, so we have the leg lift, works on the quadriceps. You can do that. You have the pec and stretch, pec, stretch, and squeeze. You can do that. So here are some of the exercises I've put there for you. Easy office exercises, the stretching ones, your shoulder, the neck from side to side, the turning around of the head, the up and down, trying to get your hand over the neck and trying to stretch your legs, trying to just bend down till you touch your toes or your ankles. Very, very important exercises that you can do all through the day. You have to move it, move it. You really have to move it. All right. In summary, then I'll give the chance for questions. I promised I was going to leave 30 minutes for questions. We worry consciously or unconsciously most of the time about things that will not happen. But I want to state here emphatically that that which we have as humans, the instinct, is good, because that is what the animals use in the forest to keep safe. That instinct, oh, I feel this way, maybe this is going to happen. But we should be careful how we recognize patterns and anticipate things and fill in the gaps. For example, you're going somewhere, you see others running, so you have to run. Because one, as soon as you see others running, the first thing that comes to your mind is there is danger. Oh, my boss gave me a very bad look. This guy, he doesn't like me now, or she doesn't like me. He might fire me. Oh, my husband or my wife came home smelling of perfume. This perfume is not on our table. He or she is cheating. So these are things that we do that really move us and bring us to the stage where we become stressed, anxious, and it leads to other things. We should take care of that. Your daughter is somewhere, you call your daughter 1, 2, 3, it's not picking up. Oh, something is happening. This is how our brain works. Our brains, we fill in the blanks where we realize there are parts of a missing information. Don't underestimate the power of your thoughts. If you can disrupt the flow of these thoughts, that is the ones that make you perceive threats, jump to conclusions, make associations, recognize patterns, and then you are stressed for no reason because there is realistic anxiety. Anxiety that you see the problem is staring you in the face. And there is unrealistic anxiety. This is the one I'm talking about. The thing has happened, is past and gone, and you are so anxious, you think it will happen again. We need to disrupt this flow of thoughts. They will come, but we need to find a way to disrupt the flow of thoughts. Don't engage in maladaptive coping strategies. Strategies that are harmful, like the one I've mentioned, ineffective, because we've mentioned that it's not a source of stress that actually causes your burnout, but your inability or your lack of recovery activities, relaxation, the type of coping strategies you use that can make it become chronic stress and then lead to burnout. Note, burnout itself is not classified in our DSM, just like as a mental health disorder, no. But the things that can arise or the repercussions when you get to that stage that can arise are those that are classified: depression, suicidal ideation, substance abuse, and other things. These are the things that can happen to you if you don't control it. So the maladaptive ones are the substance abuse, or you just want to take one jot. After the jot clears, you still need to deal with the stressor. You still need to deal with the situation. You numb yourself, shut down your feelings. You think that just by shutting it down, everything is gone. It's okay to cry. It's okay to feel angry. It's okay to feel stressed. But what do you do after that to take care of the situation that it doesn't become something else? You procrastinate, we daydream. Sometimes you just want to avoid. Some of us, for every conflict, we behave like the tortoise. You want to put your head in. It's not every conflict that brings you stress that you want to avoid. Some of it, you must just get on with it head on. Either you compromise, you find a resolution, you do something, you discuss. So you don't use certain strategies to avoid the stress. There are times you need to deal with it. Some people will just be eating. Anytime they get food, you are eating because you are stressed. And then you ask about, I'm stressed. And that is not a healthy coping strategy. It's maladaptive. Negative talk, rumination, playing the past mistakes. I should have said this to this person that is past and gone. Why did I do this way and I failed? I shouldn't have done it this way. You are stressing yourself. You are obsessed with criticism, constantly thinking about the criticism, the negative feedback you received, over analyzing that social interaction over the past events. Oh, that time the person spoke to me and they said this and they said that and they said this. Let it go. Focusing on regret, worrying about future events. You are preoccupying yourself with future events so much. It doesn't mean don't plan for the future. But you see, your plans are there. Yes.
Yes, please, I wanted to kindly remind them to fill the second survey so that I can complete my analysis, because only a few of them have filled the second one.
All right, thank you. So please do. I think I requested that Mr. Swansea should quickly analyze so that we get an idea of what is happening in the group. Right, so worrying about the future events, criticizing yourself is not going to help. These are maladaptive coping strategies where you feel hopeless. Some may even turn to violence in the workplace. There's incivility. You tend to start insulting other people. You bring it home. Your spouse is in trouble because you are stressed. I mean, these are maladaptive coping strategies. Learn helplessness. I can't do anything about it. So you raise your hands in the air and that is it. It's not a good coping strategy. Problem-focused coping, if it's about the work that is too much, if it's within your power, plan, break down the task, have backup plans, delegate, negotiate, talk with your boss. Well, somebody will say easier said than done in the Ghanaian culture where authority relationships, you can't talk back, but give it a try. Okay, set realistic goals and boundaries, especially in our culture where as a health professional, if you don't take care, you are in a church, you have classmates, you have relatives. And so if you don't take care, half of your clients will be church, relatives, classmates, and you can't say no. Learn how to say no. I'm not saying do not help, but to relieve your stress, learn how to say no. And yourself, what part of your life is also causing you so much stress? Is it social media? Is it your phone is always on? Is it always looking at videos? And when you have to be resting and sleeping, you are looking at all the status of all friends before you sleep. That's not the best thing to do before you lie down to sleep because your mind will still be processing these things. Set realistic goals, self-boundaries, and boundaries with other people. Then seek help. Seek help. If you are in a church, a group where you think you can trust somebody, seek help. And I always say these things that within the church setting, you should be able to get financial help, informational help, social support. Okay, so financial support, informational, social support. Very, very important. So seek help if you've come to the stage where you feel you are just not coping anymore, you can't take it. And that said, I mentioned in the beginning that I invited a colleague, a partner. We do a lot of trainings together. She is in Sakumono, she's here online, but there are other psychologists you can see, but this is a practice I know. It's Equilink Psychological Services. It's in Sakumono, and Dr. Usiza, I've known her for quite a while, and we work together. She's more of a sister than a partner. So seek help. It deals with clients both in and outside the country, and I can guarantee that your confidentiality is assured because we deal with companies, etc. So seek help. There are other psychologists in the establishment. So if you go and it's not directly to see her too, she can refer you to someone else. That said and done, with the information I have provided to seek professional help, for those who want, if you can take, but you get a slide, you can take a picture of the contacts, the address, etc. You do it, seek help. Sometimes the companies also have, we call it employee assistance programs, seek help. Conclusion, stress, burnout, we've dealt with it, we've dealt with the process and the effects, we dealt with how to manage, and we're giving you some coping strategies that you can use in managing stress, in managing so that you don't get to the burnout stage where now you feel like you can't take it anymore. I will give room now for questions, and we are 3 online, so we'll try to answer your questions as much as possible to the best of our knowledge. So over to you. I think I give it back to the Gand to take over, and maybe, I don't know, let me see first if we have questions in chat.
Thank you so much, Dr. D'Souza and Erasmus. This has been very, very insightful. I believe that there are several aspects of our lives we have seen that we are stressed, and some responses we give to some things. Actually, some of the insights you have given shows that they were due to stress. So I believe a lot of us will have quite a number of questions to ask. Someone asked this in the chat, I think earlier on, and I want to read that first. Said, please, how can you manage stress? How can you manage stress-related migraine and reduced sexual appetite or sexual desire? How can you manage stress-related migraine and reduce sexual desires? This one came earlier before now. So if you can take that first, then I will ask people to raise their hands to ask their questions.
Okay. Is Dr. Wusiza online? Hello. Do we have Dr. Wusiza online? Oh, we can't hear her. I think she's trying to. Okay.
From Senam Klonaga, our acting general secretary and PRO, he said it has been very insightful and educative. He said kudos to you and thank you. All right.
Okay. So I will answer. I wanted Dr. Wusiza to answer because we see some of these things, especially she, most in practice. So I wanted her to answer that practically. But yes, stress has the 4 quadrants. It affects your behavior, your emotions. Physically, you feel sometimes psychosomatic. So you have stomach aches, you go to the hospital, and you can't find anything. And you wonder why. You get your migraines, you get the palpitations, etc. So the only way to take care of it is that, you see, the stressor is there. Sometimes you can't deal with it per se. So if it has to do with overwork, that is causing you to be so tired that the sexual appetite is reduced, then you have to try and strategize and find what to do. So if I call it, and I think I have somebody online who will laugh, I call it Moron Day. So Moron Day means that there were a couple who went for therapy, and the counselor said, all right, let us strategize and have days that you can have sexual relations. So all the days with R in them, you can know that when you go to the office, this particular day is an R. So that day is for activity. So don't stress yourself, make sure you close early, etc. Now it happened that one of the couples wanted to have relations. So Monday had no R, and he came home, or she came home and said, darling, isn't today Moron Day? So that let's add R there and let's have it. So what am I saying? You need to strategize. For the migraines and the headaches, I would not say if they are directly as a result of stress, unless you've seen a professional and you know that is the reason, but there may be other underlying conditions. So I would not say immediately that it's a result of stress. But if it is as a result of stress, then please, you know that you are getting to the stage where other things can come up. So use some of the strategies, try to relax, set your boundaries, find time for yourself, because you can't continually take paracetamol. It may not even work. Okay, get time for yourself. This is how best I think I can answer it for now, because there are other things that I must know in context to be able to give an answer to this.
Thank you so much, Doc. Please, it's now we can now raise our hands if you have any question to ask. Then I will allow you to speak. Anybody with any question to ask, please let me see you by hand. Or otherwise, you can just unmute and address the moderator. Then you can speak. Any question?
Hello, Prince.
Yes.
Okay, so there are 2 other questions in the chat. One is from Felicia. She wants to know how she can determine when she is stressed. And then another is asking if there are checklists to know that you are burnt out. I think that was before some of us commented, so maybe you may have missed it.
Okay, I missed that. Okay.
Yeah.
All right. So Doc.
Yes.
Sanam, can you repeat the questions, please?
Yes. So the first one is, are there checklists to know that you are burnt out, like you have burnout? And then how do I know I am stressed?
Okay, so the first is that for stress, we have the quadrants, and I think Kelly mentioned some of the things to you to know. Then you are stressed. So you get to the stage where you really feel like there is overload on you. And I want to also state here that the stress in itself is not a bad thing. So let's use the word when you have gotten to the state of chronic stress. Acute stress, when you get to the state of chronic stress, that is when you should start worrying, but you need to take care of the things that will make you stressed. So the work overload, you feel like you can't really take it. You have to work under pressure. Your work demands that you work very fast. Your work demands that there are deadlines, and some of them you can't meet. You know you are getting stressed. You are irritated sometimes. So we have what we say the ABC of attitudes. First is the feeling. I feel that this is happening. First is the thinking, the thinking. I think that this is happening. I think that my boss is overloading me. I think that the work is too much. I think that the deadlines are too much. Then you begin to feel it. You feel that pressure. I feel the pressure on me. I feel that I can't take it anymore. Then now it becomes a behavior. Now you are irritated. You feel helpless. Something small, so the spillover, okay, there is conflict now. The spillover, you come home and you raise it on the children and your spouse. You just can't take it anymore. You start seeing these bad, negative emotions. Okay? There are times I even feel like crying. You know you are stressed. Whilst I was going to the PhD, I remember one time I could feel the stress. I had finished, so I was juggling between going for lectures and also trying to do other things. It was close of day. I got to Tetekwashi. There was so much traffic. I just could feel so tired. I didn't know what to do and ask myself, why all this problem? I parked my car and I was just crying. That's stress. I was just crying because I didn't know whether to pass the motorway. I didn't know where to go again. I was just crying. So you can feel all these emotions welling up. You know you are getting to that stage. Yeah.
Thank you so much. Then the second one, Sanam.
The second one was, are there checklists that you can use to determine whether you are getting to the burnout stage?
Yes. Kelly, we don't want to answer. We have the Maslach. We have certain scales we use, but
Yes.
these have to be used by professionals and we score it. And some of the skills we're giving you. Kelly, please answer this one.
Yes, I think we have the Maslach burnout assessment tool. We also have the second burnout assessment tool by Scaffelli. All these ones are standardized ones, but it won't give you the score. We have a website that I'm sending in the group. Although it's not actually standardized, it could also help you because once you fill it in, it's going to determine the score that you had, and it's going to conclude the level of burnout that you have. So these ones, all these skills are instruments that we use to determine whether a person is stressed out or not, or a person is burnout or not.
Okay.
Okay. Like I mentioned, it's not really part of the DSM, but we can also look at some of the things that come out of burnout. So we use the BSI. And when we score, we know that you have some of the repercussions or kind of the consequences of burnout to say that this person is really from the burnout stage and now has moved to some of the mental health issues like depression, etc., anxiety disorders. So we look at that one too.
Okay, thank you so much. We have a question from RD Daniel Mensah. Said, how do you deal with frequent stress caused by external factors that are not within your control and affecting the successful outcome of your work?
Micromanaging is one external factor. So external factors, if I would have loved him to explain, is it within the family setting or the work environment? But I want to assume that since we're speaking about the working environment, he's talking about work. So this is why I said I'm happy that we have supervisors online. Sometimes there are factors really beyond the control of the person. And some of these things can really cause mental health issues. We can have guilt, shame, fear, helplessness, etc. It's a difficult thing to answer. It's beyond your control. So let me use the 4 A's. Can you avoid it? If you can't avoid it, can you alter it? If you can't alter it and you can't accept it, like for example, the death of a loved one, you can't do anything but just to accept it. If you can't accept it and in the place where you are, you have to move, then move. If there's no other jobs that you can do, then reframe. Sometimes I say, oh, it could have been worse. Reframe your reframe, I mean, like your perceptions whilst you are there. Find and use some of the other ways when you are at work. There are times that if you can't approach it head on to discuss with the person, reframe and find ways of dealing with it yourself. Where I find my solace as a Christian is prayer and worship. And trust that because I have committed it into God's hands, He is aware, He will save me. So this is what I do. I don't know about others, but this is how best I think I can answer, unless Kelly has something to add to it.
Yeah, I think Dr. Leslie have said it all. It's about the 4 A's. If you think you can avoid, then that would be the best way. If you think you can alter, then you can. But if you think you can't do that, then it's also advisable that you try to change the meaning and interpretation towards things. So I think Dr. Leslie, you have said it all.
Okay, so we have a few more questions in the chat. Please, is it healthy to take painkillers when stressed? And we have, can stress cause loss of memory? This is Gand Cpd. Can stress cause loss of memory? Then the third one. Okay, that's it. So we have these two questions. Yes, I have a few more, but if you can handle these two, then I'll bring the others.
Yes.
I think, let me come in first, Dr. Messi.
All right.
Yes, stress causes memory loss. That's also in the line of burnout. Sometimes you become too exhausted, and then it will affect your cognitive abilities. It also impairs you cognitively. And when it does, you experience loss of memory. Is it healthy to take painkillers when stressed? I would say that it's not that healthy to always be taking painkillers when stressed. That is why we have the recovery activities, we have the coping strategies. If you feel like today you were so stressed at work, you just get home and you decide to do something different. For example, the day that I have lectures from, I do have lectures from 8 o'clock in the morning till 6 o'clock in the evening, because sometimes I have like 4 books. And once I finish and I come, I just lay down in my chair, find something to eat, lay down in my chair, watch some movie, or watch what is going on till I fall asleep. It is all part of recovery activities. I won't go and spend the whole day from 8 o'clock to 6 o'clock teaching. And then when I come back, I start working on some assignments or some research work. No. So it's about how we recover from this stressful activity. So if you are stressed, don't think about painkillers, just relax. Go to the beachside, go to some place, relax, have fun and stuff, and that will help you a lot.
And I also want to sound a note of caution here is that, again, it's not the stress, it's the chronic, prolonged exposure to the stressor that can lead to the emotional exhaustion, physical exhaustion, and the psychological exhaustion. And yes, if somebody asks, we've said it, you can get into from the burnout stage, then anxiety disorders, the symptoms of the social anxiety disorders, panic disorders, etc. comes in, depression, substance abuse, cognitive impairment. You can't take correct decisions anymore. Irritability and anger issues all come in.
Thank you.
Okay. Thank you so much. I have a few more questions in the chat. Does burnout lead to having feelings of dying or giving up?
Yes.
And, yeah.
There's, like I said, the burnout. I mean, if you don't deal with it, then that's what we call suicidal ideation. You can't really feel like, I can't take it anymore. Everything is dark. I am useless. I am this, because you are exhausted. So that's the stage we don't want to get to. For burnout itself, the consequences are some of these things. So that's a stage we don't want to get to.
Thank you very much, Doc. So how do you help someone who does not realize, this is from RN Felicia Danso, how do you help someone who does not realize or accept they are stressed or burnout?
Serious. So someone who does not realize they are stressed or burnout is like a doctor said, you have headaches, I don't have headaches. Seriously, the person must accept first and realize they are stressed.
Yeah.
Then you can help, but without
maybe,
that.
I'm thinking maybe either being the supervisor, knowing a subordinate is stressed and maybe trying to help, or a subordinate whose supervisor is stressed and like all the things he's doing shows that he's stressed, but he doesn't even realize it and keeps on worrying the subordinate. I think in that context, how will the subordinate or the supervisor deal with it?
So let me bring it back into the working situation.
Yeah.
So in the organization, we have reporting relationships. I'm not saying go tell on somebody, okay, but I don't know what happens in your field, but we have employee assistance programs in many organizations where it is necessary, and this is affecting your performance, affecting you. You may want to bring this up with somebody who is higher so that you can work together to solve this. But this may not be a direct answer to the thing, because sometimes there are other issues apart from you. The problem is not you. That person is stressed because of a marital issue, because of financial issues. There are moderators, mediators to this. So if these things are not solved, then we can't help that stressed person. So, but most of the time, please, for the subordinates, it's really not within their power. So please, supervisors here, help out. Human life is very important, okay? And you're not talking about that individual you're working with. It's about the family, the children, the other extended family members that one particular person has to take care of. So let's all help each other. We're already in a stressful world.
All right. So Doc, how do I deal with procrastination?
Hello.
Yeah, hello.
Yes, hello. This is May, Dr. Wolfsie's. I'm sorry.
Finally.
I had to attend to a client. Yes.
Okay.
I'll just.
Welcome.
Thank you. Thank you very much. Yes, I just saw that there was a question in the chat about how to deal with someone who is stressed or burnt out, or does not want to accept that they are heading for burnout.
Yes.
Did I get that right, please?
Yes.
Okay. So I think just before I came in, you were saying something about being each other's keeper, as being aware, as being mindful of each other's stress levels. You see, in our culture, we, especially our men, don't want to admit when they are down or when they're laboring under a lot of stress. So usually, it's the women who notice, because there's a change in behavior and that kind of thing. Well, we all go through stress. So if you feel that you are not in danger, then you shouldn't mind just having your mental health checked at a simple test. If your scores are low, all well and good, and then you're good to go. But if you should have your stress levels checked, and we have a lot of scales, I'm sure Dr. D'Souza has spoken about them, and your scores are high, then there is no denying that you have a problem and it needs to be addressed. I don't know if I'm answering your question, because I missed quite a bit.
Yes.
Yes. You see, the signs and symptoms are there. We know that we move from stress into burnout. One of the things that has always interested me about this is the three things we talked about: the exhaustion, the cynicism, and the low productivity. Now, when we have reached that point where we start to say things like, what can come. You know, it means that we just don't have it anymore. You know, we are stressed beyond coping, way beyond coping. You see, so this individual can be helped to understand that even some of the things they are saying, even the way they are dealing with life. I think at one point I heard Erasmus talking about people turning to alcohol and that kind of thing. Yes, if you can see these things in your colleague, if you can see these things in a patient, draw their minds to it. Even if they don't want to accept that they're in trouble, just ask them, walk into this hospital. A lot of the hospitals now have a psychologist or psychology unit, and just have your mental health checked. If it's fine, you'll be told, and you walk away. You use a few of the coping skills talked about to reduce your stress levels. But if your scores are high, then you do not want to play with this. You do not want to get to the burnout level. Then you must definitely seek professional help.
All right. Thank you very much, Dr. Wusiza.
Thank you, Dr. D'Souza.
All right. All right. I think on our part, we are done. And so if there are no more questions, then.
Yeah, so Doc, I have 3 more questions for you, then you can wrap
Yeah,
up.
sure. Please go ahead.
Yeah, so is napping good for, that's taking a nap, good for dealing with stress at the workplace? And I think the second one is, how do I deal with procrastination? And I think the last one, okay, so that's it, napping and procrastination. How do I deal with procrastination? And is napping a good remedy at the workplace for dealing with stress?
Yes, I can attest to that my husband is somebody who can nap 15 minutes and he's good. Then he asked me, so can't you even sleep 15 minutes? For me, I have to get a whole 1 hour to start preparing to want to sleep. But if you are somebody who can take short naps, and seriously, in the Western world, most of the Western countries, they have places where you can just relax and just nap or take a time off and refresh and come back. Some even have gyms on top or punching bags. You get into places, you just punch a bag and you come back. So it's very good for us because it refreshes the brain, the memory, and it makes you rest and you come back a bit more refreshed. And the second one was, can you please repeat?
Yeah, so the second one said, how does he deal with procrastination?
So work has a way of, if you tell somebody, okay, I want you to mow this lawn, okay? We call it the Parkinson's law. I want you to mow this lawn in 1 week. The person will use 1 week. If you say, so the person will wait, maybe I want you to mow this lawn by Friday, and you telling this person by Monday, the person will wait maybe Thursday evening to start mowing the lawn. But if you say, I want you to mow this lawn by tomorrow afternoon, the person will do it. So we say work has a way of expanding to fill the time you allocate to it. So if you are somebody who procrastinates a lot, I would say the first thing you have to do is to use time management. Give yourself deadlines. With these deadlines, reward yourself. So start by first managing your time. Then you can deal with the procrastination. Is a procrastination as a result of inability? But sometimes it is something you can do and you really want to do it. You go all the way out. I want to finish this. So why do you procrastinate? Is it because you can't manage your time? Is it because you think that there are 50 hours in 1 hour? And some people really think that. They have to get to a place by 6 o'clock and they move at 5:45. You are not in charge of the road. You are not in charge of the traffic. So it's a question of time management.
Yeah.
So these are some of the few tricks I can give just off my head.
Sure. Thank you so much. Thank you. Please, you can now wrap up, then we'll come and do our vote of thanks and close.
All right, I think I am done. I really enjoyed being with you, and I wish we had 5 hours to keep talking. So thank you very much for having us. And Kelly, please have the final word, and then we'll finish.
Okay. As Dr. D'Souza said, thank you very much for your time and also having us. The survey is something that I hope, or we hope that you guys could wholeheartedly complete the survey. For example, with the first one, we had about 70 responses. And for the second one, we are having around 35 responses, which is not encouraging. So we will hope that we could still prepare the report and send it to you maybe next week or next 2 weeks. The only thing that we require is that you guys should try and fill the first and the second survey. Even for your colleagues who are not around, you could send the surveys to them for them to fill the 2 surveys so that we could have a general report, not based on findings from different stages, but findings based on the people that we designed the workshop on burnout for. For example, the preliminary analysis that I did here showed that when it comes to psychological detachment, how you can detach yourself from your work, majority of you did not know how to do that. You guys don't know how to forget about your work, how not to think about your work when at home. It's not, you keep thinking about these things. However, 68% show that they engage in relaxing activities like staying back and relaxing, which is a good thing. So these are some of the things that I could say. Overall, it seems that the burnout level, the burnout level seems to be very moderate because majority of you said that you sometimes experience burnout, which seems like it's a good thing. So for that, you could say that your burnout is rather moderate. Your job demands are also slightly moderate, although we had about 70% saying that sometimes they do work intensively, they do work very fast, and their work demands too much effort. Majority also reported that they have enough time to do their work. And about 50% also said that their work is very, very conflicting. The demands are very conflicting. When we talk about the health aspects, the stomach problems and stuff, we could observe that here we have like a split. About 50% are saying that they do sometimes and very often have stomach problems and stuff due to their work, whilst half also said that they do not. In terms of chest pain and stuff, also there's a split here. So what I would like to say is that for us to finalize all these findings and maybe draft a report and provide it to the association, it's very important that the association also tries to let its members try to fill the survey as much as they can so that we could have this draft or a report personally for the association. I think this could help the authorities to maybe put in place certain interventions to address your concerns. So this is what I would like to add. Overall, let's say thank you for your time and thank you for having us.
Thank you so very much.
Prince, a final word. I just want to add my voice to this. We had an intervention in a company, a big company in Ghana. I don't want to mention it, but we did something similar. We wrote a report, and this Dr. Wushiza was with me. I think at a point there was a conflict between the management, but within a few months, that organization, the thing exploded, and it was a whole issue with strikes, and they lost a lot of money because performance was affected. So wherever we go, we try to do these things. We do a survey, or we try to take something just to give you an idea of what is going on. But at the end of the day, this is to enhance your performance and your productivity. So this is what I want to say. Yeah.
Yes, we will.
And also just to come in, I think Dr. D'Souza said you're about 600. So at least if the authorities will try and make sure that we get half of the people responding, then we could provide a more valid and reliable report. So this is something that I think I'm going to leave to the authorities and people here to try and find ways to get their people to complete the survey.
Sure. Right. We'll try and push to our colleagues to fill. I think we started, we put it on this morning. So as a few days ahead of us, we can work on this. And I think we can get many more people filling, right? So Dr. D'Souza, Dr. Caesar, Erasmus, we are grateful. In fact, I don't know how we would have gotten the three of you to do this for us, but we don't take this for granted at all. We are very, very, very much grateful for your time and for the deep insight you shared with us. And I believe that from today, the Ghana Academy of Nutrition and Dietetics will record very healthy psychological environment, and then it will impact on our performance as well. We are very much grateful. I know that when we are to suggest the subsequent CPD topics, many more topics will come up that will be in this area. So I know this is just the beginning of our relationship. We will have you for other things, and we'll collaborate to do more things as well. So thank you so very much once again, and we'll love to have you back. We'll love to have you back. Right. So having said that, RD Yannick was asking whether there are outlets for persons who feel near burnout to access help. Yes. Dr. Caesar spoke about the various psychology units in our hospitals. So if you are in a facility that you have a psychologist, fortunately for us, if you are a staff, you have access to these people. Please go and have yourself assessed, and if there's any help you will get. If you don't have, you also have private facilities that can also assist. So please, yes, there are help or various helps for you. And those of you who haven't filled the attendance form yet, we'll put it on again, and we will ensure that we'll wait for a while before we sign up, so that you'll be able, or we sign off, so that you'll be able to fill the attendance form. Dr. D'Souza, Dr. Caesar, and Erasmus, once again, thank you so
All
much.
right.
God.
You're welcome. So we'll log off now. Thank you very much
Yes,
for having
please,
us.
you can.
All right, thank you.
Bye-bye.
Asiedu.
Yes.
Please, I think yes, we can stop the recording so that.
Oh, okay.
Yeah.
Where are we?
Yeah.
Okay.
Great. Thank you.